Yeah, so open a class. So as I was told that this particular lecture is to talk about the planning. And the planning, in fact, even though it's from a health promotion actual perspective, but planning is a planning anyway. So basically, we are just going to go through the basic concepts of a planning, and then talk about the program management cycle. Okay, and then after that, we will talk about the framework and the template for preparing a plan. So that is what we will cover in this class. So let me share my outline. So basically, so just like I said, we are going to actually go through the planning. So hopefully by the end of this lecture, you should be able to actually define planning, particularly from the health promotion perspective. Well, whether health promotion, health, or disease prevention, or program management, the concepts of planning remains the same. Can I just say that please feel free to stop me and ask questions if you hear the concepts that you don't understand. So please ask questions, and then I will stop speaking, and then I will attend to your question. Let nothing hold you back from you asking questions to actually clarify. So, yeah. Okay. So, I am going to ask your your course coordinator, if I am to give you an assignment. And the assignment that I have actually given to our guys in our guys doing an MPH HPM track is this. But let me confirm from your course coordinator if I should give you the same assignment as well. Okay, so now talking about a plan. And ideally, I should ask us to first of all discuss what we think a plan is. Can we briefly talk? Can any person tell me what a plan is? I know we all know what a plan is. Everybody prepares a plan. But if you are asked to now define it, how would you define it? What is a health plan? Or what is a plan generally? Yes?
Good morning, sir.
Hello, Omolorun.
Yeah, good morning, sir. So
Yeah, good
I
morning.
think a plan has steps. There are steps put in place to achieve a particular goal.
Can you say that again? Sorry.
So they involve steps put in place to achieve a particular goal.
Okay. There is one word that you said that I wanted to catch. That the plan is something that you put in place to achieve a particular goal. So what word did you use to describe that as something?
There are steps.
Steps. Okay, steps. Thank you.
Yes,
Thank
sir.
you. Steps that you draw. Okay, not steps that you take. Because when you start to take those steps, then it is not planning anymore. Okay, or then it is not a plan. Okay, but the steps that you draw, that you prepare, on how you will achieve your goal. Yes, another person. Okay, okay. I'm not. Nusani Kehinde, no, Naomi said that a plan is a roadmap. Let me read it out. A plan is a roadmap that shows what needs to be done, how it will be done, when it will be done, and who will do it. Okay, thank you so much. So it says a roadmap. Thank you. Thank you. So, generally, if we go back to our outline, generally, yeah, thank you. So, we usually say a plan is a plan, like what you have just heard. A plan is an outline. It is a skeleton. But a plan must answer 7 questions. That is a complete plan, because not all plans are complete. So every plan, okay, is an outline that describes, well, we have been told steps. And then we have also been told that it is a roadmap. But I prefer the word outline. Outline that actually describes what we will do, why we will do it, how we will do it, when we will do it, where we do it, who will do it, and with which resources. So that every complete plan must be able to provide answers to these 7 questions. So, yeah. So just basically repeating that it is an outline, it is a protocol, it is a proposal, okay? Yeah. It is a set of guidelines of how we need, of what we need to do to achieve the goals of a health-oriented program, or in fact, any program at all. Okay? When you think about the question what details out the work to be done? When is the time? Where? The place? Who? The person who will do it? Which? The tools? The fund? Why? The results expected? Or the problems that led to the planning of the program or the project? So how is the strategy. Okay. So every organization prepares, practically every organization has 3 levels, and then plans are prepared along these 3 levels. Okay. And for example, you can have a top management plan. Okay. Those are the people who would usually prepare prepare organizational strategic plan, planning over the next 10 years, 15 years, at times even longer. And then you have the mid-level management plan. These are usually the project plans. Okay, program plan. Okay, that are prepared to show how we will achieve the objectives of a project that will lead to the overall goal of the program or the organization. And then we also know the first level management plans, such as planning to implement policies, and usually they contain procedures and then budgets. So these are different types of plans. Okay, just before we talk about the different types of plans, maybe we should also discuss this. What types of plans do you know? Yes, what types of plan have you heard of? Anybody? Okay, Adewale, Osamusomi, what type of plans have you heard of before, or have you used yourself? Adewale, are you there? Okay. Okay, Victor, Olamilekun, Olamilekan. Okay. Victor, please let us participate. If you are there, don't just connect without you actually listening to me. Otherwise, it will just be as if I'm actually speaking to my laptop, if the people are not there at the other end. Okay, and somebody said operational plan. Okay, which the person says is a short plan that actually details the plan of a project. Okay, yet another person, what types of plan have you heard before? Contingency plan, Coca, yes. Daniel Emmanuel.
Strategic plan.
What?
Strategic plan, sir.
Strategic plan, yes.
Yes. It's a long-term plan, usually 3 to 5 years.
Well, yes, or longer. Okay. And I'm sure our ladies, you have actually heard about a shopping plan. I don't know any lady who goes over to the market without preparing a plan. Now, do you know? I'm sure if you are going to shop, you need a plan of what you want to buy, where you buy it, who will sell it to you, and at what price. Okay? And you know how much you have and how many things you need to buy. That is a basic plan. The other plan that everybody knows is the plan that people who work in offices do, that is called a to-do list. A list that you prepare for each day at work. When you go to work, the first thing you do is to prepare a to-do list of what you will do that day. And that list will tell you the tasks, the appointments, the places, the persons you will meet, and how you need to actually prepare for it. These are all basic types of plan. And it's possible you have also heard about a work plan, an activity plan, an organizational plan, and like we have heard, in a project plan and a contingency plan. There are different kinds of a plan. And even in health promotion, you need a plan that will detail out how you will carry out activities that will promote the health of your target population. Whatever that health promotion work is, it needs to be planned. It needs to be planned. So now let us just go back. So basically, we want you to know, yeah. Yes. So basically for you to know that yes, in any development sector, okay, these are the different types of plans you will come across. Okay, in a strategic plan, just as you heard, it's a long-term top management or organizational plan that is done towards achieving the organizational vision. So it is a broad, long-term plan that is prepared at the higher levels of an organization. And then you also have tactical plan. Tactical plan, which is a medium term and a middle management in a project plan, okay, that are done to achieve in a shorter term project objectives and goals. And then you have operational plan. These, and I think this is the type of plan that we also call the work plan. The work plan is the plan that outlines what each team needs to do on a day-to-day basis and is prepared towards achieving the objectives, the targets, and the output of the activities being done by a team. And of course, every member of a team is expected to have a personal plan, a personal development plan. That is, the individual workers themselves should have their own plan. If you work in an office where you are a member of a team, you are expected to actually develop your own plan from the operational plan of a team that is part of the tactical project plan, and then the tactical project plan is part of the program plan or the long-term broad strategic organizational plan. And then And some people also prepare what we call a contingency plan. No, these are plans that are not for day-to-day implementation. They are plans that are made in case an emergency happens. And for example, epidemics. There are plans that you only bring out when they are needed. So, and they are the ones called contingency plans. And then one plan that I know that very many ongoing programs run is the rolling plan. Now, the rolling plan is a plan that is done continuously, every day, every week, every month, every 6 months, every year. It rolls. It rolls, okay? So that if you find yourself find yourself that's in a project or a program where you need to do the same thing repeatedly. So then what you might be asked to prepare will be a rolling plan. Okay? So, basically, for you to prepare a plan, generally, we will come back to this, just for you to know that, your plan details out what a proper project plan, what your health promotion plan, if you are asked to prepare one, will contain. It should contain this situation analysis, where you describe the baseline in the situation of the population that you know who are the beneficiaries of your health promotion plan, what problems affect them. So before you actually prioritize, and then you set your goals, and then once you know the goals, then you develop strategies. From your strategies, you then develop what is called action plan. And then based on that action plan, you prepare your budget. So that every plan that aims to answer the question, what, when, where, who, which, why, and how, must provide information about the original situation, the situation analysis of the target population, and how you prioritized which problem you will attend to first. And then it should contain goals. There are 3 types of goals. Aim, which is the long-term goal. Objectives, the short-term goal. Outputs, the immediate goal of each activity. And the strategy is just, they are the methods, the approach you will use to achieve your goals. And then the action planning contains the activities and the tasks, okay, to be implemented. And then the budget. So, certainly, why do we need a plan? So, I'm sure you have all heard it said before, that if you fail to plan, you plan to fail. So, a plan, therefore, is essential to guide the implementation of your work in a way that will help you achieve your goals. Therefore, if you do not have a plan, it means you don't have a template of the work you want to do. If you don't have a plan, it means you don't have goals. It means your work lacks direction. You won't even know whether the results you are achieving from your work are in line with the goals you were expected to achieve. Okay, so definitely we use plans to coordinate our health services so that we deliver them in an orderly, efficient way towards achieving our set goals. Therefore, if that is why we plan, now you can understand what will happen if there is no plan, or if that plan has not been prepared properly. Do we understand? Is there somebody listening to me? Is somebody listening to me?
Yes, sir.
Yes, sir. Yes, sir. We
listening.
understand, sir.
Yes, sir.
Okay, good. And therefore, for health promotion, well, if you know that, look, people say people say prevention is better than cure. But then those of us, or those of you in health promotion, say that, look, to actually promote health is probably the best form of a prevention. So yes, prevention is better than cure, but promotion might be the best way to prevent diseases happening. Therefore, promotion needs to be planned. How we promote the health of our children, the health of our women, the health of our men, okay, so that they actually develop their own the capacity to resist infections or diseases and all that, might be the best way to prevent them getting sick. If our mothers know how to keep their children being well fed, then certainly their children, they will fall sick less often. But the issue is, if you are the manager of a health promotion team, you need a plan that will promote the health of both mothers, children, adults, and the parents, the population. So, and for that to be done, you need a plan. Please note this. You must be able to describe the aims, the rationale for having a plan. So, when we think about the planning responsibilities of a health manager or of a manager, we think about what we call the planning cycle, what is also called the program management cycle. So all these are the things you must prepare. By the time I actually asked us what is a plan, somebody told me they are the steps. Okay, they are the steps of how you will do the work to achieve your goal. So there is a step-by-step approach to your planning that will lead to the implementation of the plan towards, as well as detail out the assessments that need to be done, so that we know whether the plan that we prepared has been achieved or not. And like I described before, the first step is situation analysis. So all of you should be able to draw this planning cycle or this program management cycle. So please practice it. Situation analysis comes first. Then once you have done this situation analysis, then you talk about priority setting, which means that when you have analyzed the problems affecting your target population, so you might come up with a list of problems, issues that may be too many for you to address within one project term. Therefore, you need to prioritize. So how do you choose which problem to prioritize for intervention, and especially using health promotion? Okay, and then once you have prioritized the problems, the issues, then you set your goals. Remember, I had told us that there are three types of goals, because when you have to think about the hierarchy of goals, there are three levels in the hierarchy of goals. You have the long-term goal, which we call the aim. You have the short-term goal or the intermediate goals, which we call objectives. And we have the immediate goal, which we call the outputs. So all these goals have to be formulated or drafted. And then if you have actually formulated good goals, then you have a solid foundation for you to plan your action. The action, there are also three levels of work that have to be planned. On the first level of work, they are called strategies. The strategies, they are the broad approaches. Okay, the broad approaches that will help you to achieve your goals. As an example, if I actually give us an example, okay, you have the objective that you want to improve the nutritional status of under 5 children, okay, so that the incidence rate of further okay, drops. Okay, so now you then ask yourself, how do we improve their nutritional status? So the answer to that question will come up as a list of strategies to improve the nutritional status. Some people will say, let us do high protein supplementation. That is a strategy, not an activity. Okay? And some other people will say, let us give education to the mothers on good feeding methods. Maybe if the women are more literate, then the nutritional status of their children will improve. Therefore, you can say, and the maternal literacy can be a strategy to improve the nutritional status. So, and you can have 6 or more strategies, but you need to then fine-tune them so that you have one strategy for one objective. So that every person who will be working towards achieving those objectives will be very, very clear as to the strategy that is being used. And then when you choose one particular strategy, then you break them down into the second level of work that we call activities. Now, activities, they are what you do to execute a strategy. As an example, if you choose adult literacy as a way to improve the nutritional status of children, so then you break that particular strategy in literacy into activities. Okay, someone will give health education. Someone will teach the mothers. Someone will actually develop the the tools, the materials. Someone will organize the place. So these activities, community mobilization, community education, maternal, each of these, they are all activities that are usually done by a team, a health promotion team. And then the last level of work is the level of work that we call task. A task is that work that you assign to one person who is a member of a team implementing an activity. So that when you take one activity, you can break it down into small units of work that we call task. And the task you assign to each member of your team. So one person does one task, but one team implements an activity, and the whole project implements a strategy towards achieving the objective, so that when you are planning the work or the action that you will do to achieve your goal, you think about strategies, you think about activities, and you think about tasks. So that, yes, you can have the plan for your strategy, you can have your activity plan, and you can have the work plan. The work plan contains tasks. Okay? The action plan contains activities. And they also contain a list of the strategies as well. So once then the other thing that you plan during the action planning is your budget. Because once you have your activities, then you should be able to then ask yourself, what resources do we need to implement these activities? So these activities, you cost them. How much resources? The resources, how much do they cost? And the cost will be what you build into a budget. And then the implementation phase also needs to be planned. You have the plan. How will you implement it? So that is the action implementation phase. So, typically, if you are the manager, you need to know how you will coordinate the implementation of your activities. But it all begins with you mobilizing the funds. When you mobilize the funds, then you allocate the resources, then you deploy your staff to where the services will be delivered, and then you coordinate their work, and then from time to time, you also organize how you will monitor them. Therefore, implementation is done at the same time that you monitor. So, yes, you monitor the progress during implementation. Okay? And following implementation and under the monitoring, the last stage of your planning cycle is the impact evaluation. All needs to be planned. You need to plan how you will evaluate your activities. So you need to plan how you will monitor your activities. You need to plan how you will implement your activities. And then you need to plan the outline of the work, okay, as that would detail like a roadmap of how you will implement the work and how you will achieve your goals. So the goals need to be formulated. And then you need to do a proper situation analysis and the appraisal of your priorities. So this is what we call a planning cycle. Does any person have any question on this? Because what I now want to do is for us to go through this step by step. Okay? Step by step. If we don't have any question, let us go on and then talk about the situation analysis. This is the situation analysis. The key question that guides what you do during that planning stage is the question, where are we now? This is the activity that is done before the project itself is put on paper or before it is planned. Where are we now? Talking about the target population. Where are they now? Talking about your own project. Where are we now? So, therefore, you need to do a cross-sectional survey that will assess the baseline situation. Okay, the main purpose is for you to identify the key problems affecting the population. The needs, well, in your own case, the health promotion needs of the population because of their problems. And then you need to also analyze their context so that your health promotion plan will be realistic, will be contextualized to the environment in which the target population live. So, therefore, 3 main tools that we teach as that you can use when you are doing situation analysis. One is the one we call a SWOT analysis. The other one we call a gap analysis. The other one we call the problem tree analysis. Because this is only one lecture, I might not be able to go into details, but it will be good for you to know how to do a SWOT analysis. By SWOT, SWOT means S means strengths, W means weaknesses, O means opportunities, T means threats. So that when you are doing SWOT analysis, after the baseline survey, you use the results of the baseline survey to identify the strengths and the weaknesses of the target population, also to identify the opportunities and the threats of their context. The threats, they are the risks, the negative factors that are affecting your target population. Threats, they are called threats, they are called risks because they are still potential. Their effect on the target population at the stage of you planning are still potential issues. Okay, they are not weaknesses yet, but they are such factors that are negative that if not addressed, they can become real weaknesses affecting your target population. Opportunities, they are the positive factors in their context, in the context in which they live. So these factors are there, and if you continue encouraging these factors, they might benefit your health promotion program. So we call them opportunities. Okay, so let us see how much time we have for me to see if we will have time for us to have a practice SWOT analysis session. When we say gap analysis is just you calculating the difference between what is expected and what is available. So that when we talk about gaps, you actually use them to analyze gaps in the resources, to also analyze gaps in the performance, because gaps is always expected minus availability equals gaps. As an example, if you expect your health promotion team to go to the community at least 5 times every week for them to visit PHC centers, to work with them, for them to actually carry out health promotion activities. When you are doing the gap analysis, you ask them, how many times a week do you people visit the community and the PHC centers? Maybe they will tell you once, or and at times, none at all. But they should go out 5 times a week. So the gap, if they go once, the gap will be 4. Expected minus the availability, or expected minus on the current value will give you the gap value. And then when you do the problem tree analysis, this is a tool that helps you to relate the causes and the effects of these problems so that you are able to then arrange them according to a particular hierarchy that will show which problem is the primary problem, the secondary problem, the tertiary problem, and the broad overall problem affecting them. So how you know the primary, secondary, tertiary problems and the overall problem is when you do a problem tree analysis. There are a range of other types of analysis that are done, for situation analysis, but these are the 3 that we'll teach in this course. So this is what we call situation analysis. Priority appraisal, like as I described before, after you have identified the problems, you need to then rank them. Which problem should be the first priority? Which problem should be the last priority so that you don't waste your time and your resources? The way by which you appraise the priority levels are when you use certain priority ranking matrices, okay, to know which problem you should deal with first. Now, the commonest one is the one that is called the importance urgency matrix, where the importance is determined by the size of the problem, and the urgency is determined by the effects of the problem. So that when you plot them in a 2x2 table, you should be able to now plot high and a low size, or high importance, low importance, plot against high urgency and low urgency in terms of the effect of that problem. Basically, the effect is what will happen if we don't do anything, or how is this problem affecting them now. So that when you do this importance stroke urgency priority matrix, you will come to now find that any problem that has high importance and high urgency, that will be the problem you should put as your first priority to deal with. Do we understand that? Is that clear? And then the problems that have low importance and low urgency, that is the problem that you put as your last priority. And then the other issues of high importance, low urgency, or low importance and high urgency, This will be in between these two extremes. So, and that is the easiest way by which you can identify what problems or what issues you should give priority to. So other people will use other criteria, such as the availability of a situation, the feasibility of that particular solution, and the local acceptability, the effectiveness of the intervention, as the criteria by which you will use to rank which problem you should deal with first and which problem that you deal with last. So all these are what you do when you do priority appraisal. And then when you formulate your goals, please stop me if you have any question. Anything that you don't understand, ask me, and I will explain further. So when you formulate your goals, you are asking yourself, where are we going? Therefore, you start by you formulating your long-term goal that we call your aim. The long-term goal is the broad general statement of the impact that you want to achieve. The impact is the long-term effect of your intervention. So the aim is the long-term goal. So for you to know what the impact is, the impact is the change expected to occur in your target population by the end of your program. So it is a terminal goal. It is a long-term goal or a terminal effect or a long-term effect. The aim is the goal that expresses that impact. And it is important because the overall purpose of your program will be evaluated based on your aim. It is your aim that will show whether your intervention has been successful or it has failed. Therefore, every program, every project must set an aim, must set a long-term goal, because that is what answers the question, where are we going? And once you have formulated the aim, the next thing that you formulate are the objectives. The objectives, they are the smaller goals, what we call the milestones that are achieved on the way to achieving your long-term goal, your aim. So that all the objectives of your program must all be connected to at least one aim. Because the objectives, they are the milestone achievements that will produce the long-term goal. But while the aim is a general, broad goal, objective is a specific, measurable, attainable, realistic, and time-bound goal. It is a specific goal. So, therefore, you need to break down your long-term aim into smaller goals that we call objectives. The objectives, they are specific because they contain, you state a specific outcome. They are measurable because you state the indicator. They are attainable because you have set a target that you can achieve. They are realistic because the time frame is fixed. determining what you can achieve within the period that you have fixed. So every objective is a rigid goal. Rigid in that it is specific, it states the indicator, it states the target, and it states the time goal by which the target must be achieved. So, therefore, when evaluators come to then evaluate your program, they determine the effectiveness of your work by measuring the objectives. Do we understand, please? Are you following? Do we understand what I have said about the differences between the aims and the objectives?
Yes, sir.
Okay.
So I don't
Yes,
really
sir.
understand it, sir.
I do, sir.
Okay, you do. Thank you. So that when you come to the goal part of your plan, okay, the aim is the long-term goal. What you hope, the effect, the impact you hope to achieve after 5 years or by the end of your health promotion on a project. Objectives, they are the shorter term changes, the results you need to achieve towards achieving the aim. Therefore, they must be smart, specific, measurable, attainable, and time-bound. Okay? And so the way that you formulate your objective, for it to be specific, you specify the outcome. The outcome is the short-term change. And for example, improve the nutritional status. That is an outcome. And you also specify, for it to be measurable, you specify the indicator. The indicator is a measure of the outcome. Basically saying that what is the nutritional measurements that you need to actually measure that will tell you whether the nutritional status is improving or not. So those tools are what we call indicators. Quantitative indicators, they are quantitative measurements, such as the proportions, the percentage, length, distance, width, average, ratio. Okay? So all those, so you state the indicator so that the objective can be measurable. So for us to know whether you can attain the improvement of the nutritional status, you need to set a target for your indicator. How far do you want to achieve? And for example, if it is weight, you want to know whether the nutritional status of the children are actually improving by virtue of the indicator of weight. So the target will be that you want them at their first 1 year, they should weigh not less than 10 kg. So weight is the indicator 10 kg is the target. And then you will say that, okay, for them to weigh at least 10 kg as at 1 year, okay, so that 1 year gives you a time frame, which is a short term. So a short term time frame can be 6 months, can be 9 months, can be 1 year, can be 18 months, but not more than for it to be short term. Okay? So every project, therefore, must formulate objective in their plan. Let us go back. Okay, good. So, therefore, when evaluators or supervisors or monitors come to check how well you are doing, it is the objectives that will tell them whether your work or your intervention is effective or not. So, for each objective, for each short-term objective, you need to select a strategy. As I explained before, the strategy is the method you intend to use to achieve your objective. And the example that I gave before, if your goal is to improve the nutritional status of children such that their weight is not less than 10 kg at the age of 1 year. So that is a smart objective, but how will you achieve it? It is possible, you say, protein supplementation as a strategy. Usually you will come up with a number of alternative strategies, and then you select one based on certain criteria that will help you find out which strategy is the best strategy for each objective. So as an example here, I said to improve the economic capacity of adults, as an example, a potential strategy might be a VIG project or VIG, VTC, vocational income generating project. So the strategy here will be vocational income generation. A strategy is different from the activities because once you have selected this as your strategy, then you need to break them down into activities related to vocational income generation. So that all of us must know how to select strategy. So once the strategy has been selected, then you prepare an action plan for the activities to implement each strategy. So that is what we call the action plan or the activity plan. But, okay, the action plan contains the activity plan, also for the plan of activities for each strategy. It also contains a work plan, the set of specific tasks for each activity. So one thing about the action plan, like we said at the very beginning, your action plan must answer to the 7 questions. What work do we do? When do we do it? Where do we do it? Who will do it? Why should we do it? With tools, and how should we do it? So that you prepare that for the activities and you prepare it for the tasks. And then you also think about the assessments. How will we monitor our work? So you prepare a monitoring plan. How will we evaluate our results? So you prepare an evaluation plan. So all these plans are what you do during action planning before you come to the budget. The budget is the financial plan of your health promotion intervention. Okay? Just as I said before, you list all the activities and you list the resources you need to implement the activities, and then you cost the resources, and then you build, and then you actually compute the cost into a template that we call budget. So the budget is an outline of costs, capital costs, administrative costs, and running costs. So all that. So your budget must have a budget line for every activity that you have planned. So that this is very, very essential. So once you have the plan, then you must think about the implementation. And very often the implementation needs to be planned. How do we do it well? So a team of staff, you have to train them for them to have the required competence to implement the activities. Then you mobilize the resources. You build their capacity and you coordinate the various management systems that you need to implement your plan. So usually monitoring, in fact, not even usually, always, monitoring is done during evaluation. The monitoring is the assessment that you do while implementation is going on. It is an assessment of the performance of your work. Therefore, the performance is continuously being assessed, continuously being tracked, continuously being checked, continuously being measured. And you call that continuous assessment of a performance during the implementation stage, you call it monitoring. So what you assess the quality, you assess the progress, you review the results so that you ensure that the work that is being implemented is going according to plan. So this is what we call monitoring. So the last phase of the planning cycle is what we call the evaluation stage. So when you systematically investigate the results of your intervention. So this evaluation also needs to be planned. How will we carry out the evaluation? So you need to plan, okay, Usually, how the indicators of all your goals will be measured. When will we measure them? How will we carry out the evaluation? And for what purpose? What will we use the evaluation results for? All needs to be planned before the implementation of any activity at all. So, talking about writing a plan. For you to write a plan, you write it in a way that it contains 6 sections. The first section is the section of the situation analysis. The second section is the section of goals. The third section is the section of strategies. The fourth section is the section of action plans. The fifth section is the budget. And the sixth section is the section of your analysis of the risks and the benefits, what we call assumptions. So every project plan is built upon this template. So that if you are asked to prepare a project plan for your health promotion work, the first thing you do is a situation analysis. Okay? And then you write what the goals are in section 2. Section 3, you write about the strategies, how you selected them. Section 4, you detail out all the plans. Strategy plan, activity plan, work plan, monitoring plan, evaluation plan. They are all discussed in that section of your health plan. And then the budget, as I said before, you list the activities, you list the resources, you cost the resources, and you build up your budget using a basic template. And then the section on assumptions are where you detail out the risks, the expected risks or the expected benefits. So if you have done a SWOT analysis well, you should not have any problem. Now let us read this, the remaining half hour that I have for this lecture. Let us see if I can teach us how we do a SWOT analysis. So can we all read this case study? Can I ask one of you to kindly read it for me? Yes, if you can see it, can you read this case study out for me?
A popular humanitarian organization seeks a proposal for a community development project in Fariki town that to be part of their poverty alleviation program of Nigeria. Fariki has a population of 750,000 women, and 80% of them are poor peasant wives who earn less than 5,000 naira per month from sales of farm produce. They are hardworking and have cooperative husbands who are willing to support them morally and financially. However, harvests have been generally poor in the last year because of unexpected famine and attack by locust infestation. In addition, the pricing of farm sales is controlled by the government, which is committed to helping farmers yield more by occasionally providing fertilizers and mechanized farming support. However, small-scale agriculture has been adversely affected in recent years particularly by national economic factors of high inflation rates and the unfavorable foreign exchange rates that have reduced central production of fertilizers and purchase of farming tools. As a result, as a result of their poverty, 85% of poor women suffer complicated childbirth because they cannot afford to transport themselves on time to the nearest health center 50 kilometers away. As a result, more than half of the 100,000 women die during labor every year.
Thank you so much. So, if this is the result of a baseline survey, and then you have been told to prepare a plan to help the wives of a farmers in this town or village called the Farichiki. So, what will be the first thing you will do? Anybody? You've been told to prepare a plan, come up with an intervention proposal. What is the first thing you will do? Hello? What is the first thing you will do? Aye. Oh, now, for example, if I give you this case study in your exam, and I say prepare a plan to promote the health of poor women in a foreign Chiki village, and I give you this case study, what is the first thing you will do? Anybody?
Pre-planning, sir.
Huh?
Pre-planning.
Pre-planning?
So the first thing I think is situation analysis, looking at the situation.
Yes, situation analysis. It is the first thing, planning cycle. So, therefore, you will do a situation analysis. So, this result has come from their baseline survey. So, your work is to analyze their situation. And the tool that you use is what we call SWOT analysis. For you to identify their strengths, their weaknesses, their opportunities, and their threats. So now, if you are to do SWOT analysis of their situation, from this case study, you need to identify, first of all, you need to identify, first of all, your target population. Okay? So now let me come up. Okay, let me just bring up a plain sheet. Please listen. Just in case you get a case study in your exam. So here, situation analysis. Using SWOT. So the first thing that you must look at that case study, you must identify the target population. So now if you look at this one again, who? If you can see this, who do you think are the target population you are asked to plan for? Taye Akinkwotu, Abi, how do you pronounce your name, Taye? Taye, from this case study, who will you say are the target population of the plan that you are being asked to prepare? Natalia is not there. Okay. Abolarin. Abolarin Oluwatobi.
Yes, sir.
From this case study, who are the target population? Who are the expected beneficiaries of the plan?
The women.
Which women?
The
Oh,
women of
yeah, quick. Which women?
the women of Farikiki town.
Yeah, but it is not all of them that have the problems that you want to analyze. You have to be specific.
Poor women.
Thank you. So that when you talk about the target population, you are talking about the expected beneficiaries of your plan or of your intervention. And in this case study, they are wives of poor peasant farmers or poor women. Thank you. So that is the first thing that you identify when you are doing situation analysis. So now, when you look at the problems affecting these poor women, before you need to talk about their strengths first. So these, okay. So if you look at the case in the study, you need to identify the strengths of the women. So what can you, when it was being read by our sister, what were the positive things about these women? Can you still see the case in the study here? Please, Joe, answer me back. Can you still see?
Yes, sir.
Good. Now, what are the positive things about the women?
They are hardworking.
They are hardworking. Thank you. So that is their strength. So that if we come back here, so that when we say their strengths, these are the positive, the positive qualities of the women. And in this case study, they are hardworking. Okay? So now is that their only strength?
No.
What other things here can you see? talking about
They
the qualities of the
cooperative
women that
husbands.
are positive.
What of cooperative husbands?
Cooperative husband, that's a quality of their husbands, not of the women. So that it is possible that the only strength here is that they are hardworking. Okay? So good. Now let us look at what we call weaknesses. When we say weaknesses, they are the negative qualities, or let me say situation. Okay, situation. Maybe you will understand that better. Negative situation of the women. So now let me see how many of us can identify the weaknesses of these women. Now let's see how many weaknesses you can identify from this case study of the women. Yes, who is going to start us off? From the case study here, what weaknesses can you see?
Low income.
Low
They were
income.
poor.
Thank you. Low income, they are poor. Let me actually highlight them as we go on. They are hardworking. We have okay. Where is okay? Poor peasant wives. They are poor. That is one. And then somebody said low income. They earn less than 5,000 per month. That is low income. Yes. Any other weakness
harvest,
of the
sir.
women? Huh?
Poor harvest.
Yeah. Poor harvest. That is their context. That one affects everybody within the community, not just the women.
Sir, attacks by locust.
Eh?
Attacks by locust infestation.
Yes, that attacks the whole town, and not only the women. When you say weaknesses, your focus should be the problems of your target population. You don't talk about their contextual issues. And for example, when
What of
rain falls in a community, the rain falls upon every house, Abi. Hello? When rain falls in a community, the rain falls upon every house. Is that not so?
Sir, yes. Yes, sir.
So that is the context. But when a house is burning, does the fire burn every house in the town?
No, sir.
That is the weakness of that house. So that in the same vein, when you are asked to identify the weaknesses, think about issues that affect only your target population. Okay, we have already identified 2. There are about 4 others. Quick.
what poor access to health care?
Yes, that again, that affects everybody. But anyway, okay, maybe because the health center is far, 50 kilometers, that affects everybody. Therefore, that's a contextual issue. Yes? Go on. Let us do this together, because when you have a case as a study in your exam, it will be only you. Now let us do this one together now. Oh yeah?
Lack of mechanized farming support.
Yes, that affects all the farmers in the village.
Okay.
That's a contextual issue. Look at the weaknesses faced by the women alone. Hey. Can you people see this? Poverty, we already talked about that. How about this one?
Childbirth.
Eh?
Complicated childbirth.
Complicated childbirth, Ojare. Thank you. This affects only the women. That's a weakness. Any other one? Cannot afford transport. That affects only the women because they are poor. What other things? Oh, yeah. Hey.
Majority of them die during labor.
They die. No maternal deaths. Okay. Okay, the last one now. They cannot transport themselves on time. Delay. They don't get there on time. So that basically, all these are what you will write down if I give you a case study in your exam. And I say, I identify the problems, okay, and affecting the women who are going to be beneficiaries of your health promotion plan. Basically, this is how you identify. So if you, please make sure you understand this. So weaknesses of poor women, they are the negative situation affecting the target population alone and not the whole community. So, and what we have now listed, we said they face poverty, they face low income, they face cannot afford poor affordability, can't afford transport. During childbirth, and then complications, labor, and then deaths, and then delay. Do you understand this? So these are the problems we have identified. Please make sure you are following, because we are doing it together now. If a case study comes up in your exam, you will be the one to actually face it alone. So now we have talked about strengths. We have talked about the weaknesses. So now you need to identify the opportunities. So the opportunities, these are their positive, supportive context. Contextual contextual situations. So all those things you guys were actually talking about, that I said, that affects everybody. That affects everybody. The ones that are positive, they are the ones that we call opportunities. And the threats, they are the negative, no, yeah. The negative hindrances, hindering context, or hindrances, sorry. In their context. Okay? So that with this, let us identify the opportunities. What opportunity did we say? What factors in their context did we say is actually positively supporting the women from this case study?
Oh, they have a cooperative husband who are
Very good.
supportive.
Husbands.
So that is opportunity, because their home, their men allows them to make decisions that will help them, and they cooperate with them and they support them. So they have cooperative. So that is their opportunity. It is, oh, okay. So, and then there are more. There are more. How about, look, I'm sure there are more things that are positive in their context. Okay. How about government commitment?
Yeah, government support.
Government support. Look at it here. Government is committed to helping the farmers yield more. So let us color this one blue. Let us also call this one too is also blue. Okay. So provide fertilizer and support for their farming. These are positive things in their context. Okay? So these are the ones we call opportunities. Are you following?
Yes, sir.
Yes, sir.
Good.
Yes, sir.
So here. So therefore you will list this here. Yes. Cooperative husband is one. Government support. Okay. Government commitment. And then provision or supply of fertilizers. Okay? And so on. Okay? So these will be their opportunities. Okay, now let us look at their in a negative context. This one, they are many, isn't it? Therefore, we should be able to now identify plenty. What are the things that is affecting everybody in that village or in that country or in that town?
Okay, sir.
That are negative.
Unexpected famine.
On what?
Unexpected famines.
And I didn't. Oh, okay, this one. Yeah, sorry. Unexpected famines. Yeah. So let us color this one. Good. Yes, any other one? Then low-cost infestation is another one. Good. Yes, any other one? Yes?
Inflation rates.
Inflation, thank you. High inflation rate.
Also unfavorable foreign exchange rate.
Very good. These are threats. Okay? These are threats. Okay? And yes, so I think basically, yeah. So therefore, you now write those ones as threats. So here we say famines. Low cost infestation. High inflation. And no, what again?
High exchange rate.
High exchange rate, thank you. Okay. Okay, and all those ones they all lead, of course, to their poor yield. Okay, and all leading to poor yield or poor harvest. Okay, so now, so you have identified the strengths, the opportunities, and the threats. But so for you to complete the SWOT, you need to draw a table. So in case this comes out in an exam, please remember to draw a table. So let us make this. Okay. So here, this is where it goes. So let's call this one positive. Let's call this one negative. And then so now this one, you say the women, the poor women, they are your target population. The women, poor women rather. And then here, their context. So the situation of the target population and then the situation of their context in which they live. So here, going from what you actually listed before, let us make this big. So here we said their strength. So their strength is their positive in a situation. So their strength here is that they are hardworking. Weaknesses, we listed many. Okay. We have talked about poverty, talked about low income, talked about transport difficulties, talked about delay, talked about debts, talked about complications. So these are all okay. So here, so opportunities. So the opportunities we said include cooperative husbands, marriages, and then committed government commitment. Okay. And then threats. So threats, okay. Threats, we said here we listed famine, low-cost infestation, high inflation, okay, high inflation, high exchange rates, okay, and poor harvest. Okay, so this is what we call a SWOT analysis table. So hope we see that it is easy to draw. Any questions on this? Any questions, please? So maybe if you guys know how you can now progress, how you if you want to know how to now progress from the SWOT analysis to the problem tree analysis to formulating goals and strategies, and then to be preparing the activity plan and the budget, then maybe you might need to sort of book another lecture section but the concepts that we want you to learn from planning, no, particularly specific to health promotion, no, they are what I have given in this lecture. So, any question? Anything you want me to explain further? Okay. And so I take your license, and I take your silence to mean you all understand. You all understand everything that we have.
Quick one, sir.
Eh?
Quick one. Sorry, sir. Please,
Yeah.
can we have the slides for this particular so that we can read more to understand?
Oh, okay. If that is going to help you, yes.
All right, sir. Thank you very much.
Know that if I'm asked to set a question on this, it will be a case study for you to do at least one thing out of the case study. Therefore,
Right,
practice how to draw problem,
weakness, strength,
and how to draw the SWOT in the table.
yes.
We have not done a problem tree. That actually will be good for us to do. And then how you can actually formulate objectives, long-term objectives, short-term objectives, immediate objectives, in order to prepare a health promotion plan.
Okay, sir.
Thank you so much, everyone.
Thank you very much, sir. I appreciate, sir.
Okay, bye-bye. God bless you all.
All right, thank you, sir.
Bye.
Thank you, sir.